Hello, my name is Tori Durham, and I'm a doctoral candidate from the University of Toledo and a pre-doctoral intern at the VA Puget Sound American Lake Division. PTSD and co-occurring issues such as anger and substance use disorders are my primary clinical and research interests. Today I'm going to talk to you a little bit about what anger looks like in the context of PTSD and some of the stigma surrounding anger. So when you're thinking about anger and what that might look like, your mind may initially go to the behavioral components of anger, such as shouting or physical aggression. However, it's important to note that there are also internal experiences that are going on that can be representative of anger. This would be such things as angry self-talk, other physiological experiences such as face redness, fist clenching, chest tightness, increased heart rate, and different things like that. Some of these internal experiences are particularly noteworthy because they require a higher degree of insight than some of the behavioral components of anger. So you may or may not know that anger is actually one of the 20 diagnostic symptoms of PTSD. That is to say that some folks with PTSD are experiencing anger related to their traumatic event. There is a portion of individuals, however, with PTSD that are also experiencing anger kind of above and beyond what's captured in the diagnosis. And finally, as I mentioned, I wanted to address some of the stigma surrounding anger. So if you've heard of the fight or flight response, you know that this is activated during times of stress, for example, during maybe a combat time. And so activating this fight or flight response also activates perhaps an aggressive reaction that can sometimes save one's life. The problem is, however, when that system gets overactivated during times of low stress and then one continues to act aggressively. That's to say that the context for which anger occurs is extremely important. Finally, another piece that I like to clarify with folks that I'm working with is that generally speaking, it's not the emotional experience of anger that is problematic. However, it's what one does with the anger. So for example, feeling angry that someone has wronged you is arguably a justified emotional response. However, acting aggressively towards that individual can be associated with some problems. So in sum, in addition to the behavioral components of anger, there are some internal experiences that are important to be aware of and take note of. Finally, anger can be trauma-related, or it might be in addition to trauma. And then becoming aware of some of the stigma surrounding anger can hopefully help folks get better access to treatment.